Hey guys, what's up? Princess Strawberry here, and in today's video, I'm going to be preparing for my gallbladder removal surgery. So today is June 22nd, and I'm going for surgery July 3rd. So we still got quite a bit of time, but I like to do things ahead of time. If I do it at the last minute, I'm going to be so stressed out and rushing around, and that's not healthy for me. It's not healthy for anyone before surgery. So you might have seen this suitcase in one of my previous videos. It's coming in handy now. First time using it, literally. So I have stuff scattered on my floor here of items I want to take with me, stuff I have to take with me or I need. So I've already packed socks, underwear, and a bra. So that's done. So also, after surgery, I have to wear loose clothing because of my incisions on my stomach. So my dad was very sweet and awesome to buy me some new pajamas. So this is this top, the pajama top that he got me. Super cute. I don't know what's going on with the camera, but alright. So as you guys can see, it's pretty loose. This is a little small for me, like it's above my belly button, but I don't care. I don't know about you guys. I like to wear a tank top and then another tank top, wear layers. So I'd probably wear a tank top and then this. So we're going to put that in the suitcase. So we're going to open this on up after I figured out it because there's so many zippers on here. So we got my socks, my bra, my underwear, and the top there. And we're going to put everything else here. So we're going to put my shirt in there. Super cute. I love it. I've actually worn these pajamas already for like 5 nights in a row before I decided I needed to wash them. I would do that if I love clothing enough. So we're just going to fold up my shirt, put that in. And then of course it comes with these super cute pajama bottoms. So as you guys can see, they're super cute. They're long. They're really stretchy. This doesn't really tie, like you can tie it a bow, but it's not going to tighten the pants. It's just there kind of for decoration, which is really weird. But anyways, we're going to put my pajama bottoms in. Again, these are super cute. I love them. I just did laundry too, which is the best part. Everything will be nice and clean for when I go. I also picked out a couple of tank tops. So it's supposed to be day surgery. If everything goes according to plan, I'll be going home the same day, but not literally, because the first night I'll be spending with my grandma. So this is why I'm packing some extra clothes. I might spend more than one night, depending how I feel. So I have a plain white tank top. It's super loose. It's not going to irritate me in any way. I think I got it inside out. I do. Well, why is there a tag on the inside and then one on the outside? Okay, I might just end up doing what I do with all my shirts and tank tops. Let's just cut the tag off. They irritate me. Is this right? This looks right. Okay. I'm not sure why there's a tag on the outside and on the inside, but whatever. So, anyways, this is a tank top. It's loose. I don't normally fold my clothes, but I felt like doing that today. We got a couple tank tops here. We got another plain tank top from George. Again, it's loose. It's not going to bug me. How do I feel about the surgery? I'm actually excited. For the past month, I'm sick and tired of being in pain. Yes, I know I'm not supposed to eat anything heavy or greasy, but I can't lose weight because then I'll be underweight and that's not healthy. So I've been eating some greasy and heavy foods. Sometimes it bothers me and causes a gallbladder attack. Sometimes it doesn't. But either way, I'm still going to eat. Like, you can't tell me not to have KFC, pizza, or hamburgers, or hot dogs. I'm still going to eat it. It's just, I'm going to pay for it later, as I call it. So, we'll get on to that later on in the video. This is another cute tank top. It's super loose. This is silk straps. Basically, really soft fabric. It's super cute. It's loose. Well, all the tank tops are basically really loose because they have to be. And then my last tank top I picked out was this one. This is actually from Ardene's. It's kind of a cute pattern. You got an open back, your armholes, and then of course the front. So you can see it's super cute. So, next. So when I do come home, I'm going to be on bed rest for either a week and a half or about 2 weeks, depending how I feel. I won't be able to bike ride. I just got my bike fixed. and I'm not going to be able to ride it right away, which sucks. I actually was riding a bike, one of my friend's bikes, a couple days ago, and it caused so much discomfort. Whenever I bend over to pick something up or whenever I stand up, sometimes it'll cause discomfort, like the stones constantly shuffle. So, Elemency, I'm not sure how you pronounce that brand name, but anyways, these are some sweatpants. They're really cute and they're comfy. That's what I'm going to be basically wearing for the first few days when I'm home. So as I lay in bed, a lot of you are probably wondering, what are you going to do on bed rest? So I went on Netflix and I found out a couple of shows that I'm really into. Unbreakable, Lemony Snicket, Unfortunate Events. There's a bunch of them that I'm into watching. So we also got a couple of blankets I can take with me when I go to my grandma's for the night. This really soft pink blanket. I also got another one here. I might even take off one of my blankets off my bed and my one pillow take with me just in case. But either way, updates will be posted to my social media sites. The links are down in the description box below. And if you guys are curious to what a gallbladder removal surgery looks like, I will definitely leave a link to a video in the description box below. Here's another really cute blanket. So that's basically all I can pack right now. I also have a bag here of some items. So we'll close my suitcase up. Now obviously I'm going to be bringing my phone and I'm going to be packing a phone charger. And I got to do a few other things before I go for my surgery, but I probably won't be vlogging that. So, the day of my surgery, I was told no makeup. So about 2 weeks in advance, I already removed my clear coat nail polish. And the day of, I had to take out my studs and take off old jewelry. I don't really want to take out my studs because if you guys have studs, then you know the struggle of that little ball, trying to get the stud in your ear, trying to get that ball to twist on. It's just a hassle. So I'm not looking forward to taking out my studs. But I either take off my jewelry or they do it for me, and there may be a possibility of them losing my stuff, and I don't want that. So this appears it's already open. So in here we got my sleep mask, because when I go to bed at night I wear a sleep mask. I don't know, I just am comfortable that way. So, and in this bag, we got all my current medication and some other items I will show you guys. So this is getting a little personal, just so you know. So we'll set the bag aside. So we got a hairbrush. It's super cute. Again, a lot of my stuff I call cute. You'll notice that. Put that in. We got sunscreen in case I decide that I'm going to go for a walk outside. And I'm not going to spend all my time, the whole week, laying in bed. I am going to get up and actually go out. So that's what sunscreen is. They told me to bring all my medication. Now, only 2 of these are actually, maybe 3 of these are actually prescription. So this is my nose spray. It's over the counter. It's because my nose gets clogged and I have trouble breathing, so this will clear it out. This is also what this Vicks stuff is for. So you just open up this Vicks. It's basically like sticking a tampon up your nose to stop a nosebleed, but you're sticking this up your nose, and it's actually pretty strong. I have a nose, I swear, like a dog. But anyway, you stick this up your nose, you breathe it in. It's supposed to clear out your nose, the back of your throat, and your throat of any crap. It's supposed to make you breathe better. Anyways, this is what it's called, Vicks inhaler. You can get that over the counter. That's not a prescription. We got my saline nasal mist. So again, you put it in your nose and you spray. It's supposed to clear your nose out. My Marvelon birth control. So you guys can see that. We got my vitamin B12 because apparently my doctor says my vitamin B is low. That's not good. And then this is also prescription. This is eye drops because I have a habit of getting really bad eye infections because I'm allergic to dust. So whenever I have an eye infection or a flare up, then I put some drops in my eye twice a day till it's gone. It helps. These are just basically refresh eye drops that I put in my eyes to moisturize them because my eyes get dry, as do a lot of people's. My deodorant. This is the deodorant I'm using currently. This is prescription naproxen pain medication because when I at first was having the gallbladder attacks, I couldn't deal with it. I was curled up, crying, literally. And then this is Tylenol, extra strength. I'm supposed to take one with my neopraxin. I can't even speak today. But I'm supposed to take one of these with my gallbladder pain medication. It's supposed to help. It doesn't always. This is why I bought a magic bag, which I'll show you in a minute. That's just an empty box for my eye drops. So all that stuff can probably just go in here. So I'll probably just throw that all in here back in the bag because the suitcase is not waterproof. So if it's raining when I take my suitcase outside, then at least this stuff is in the bag and it's not going to get wet. So that's just my eye mask. So that's all of that I can put in there. This big pouch right here, I'm going to put my phone charger and phone in a bag. They said all I need to take with me is my health card, so I'm not going to take my whole purse if I don't need to. So other items can go in here, like maybe my pillow, because it is about the size of that pocket. So if you guys have any comments, questions, or concerns, feel free. Sorry, getting up and down, causing pain. My magic bag. Normally I put this in the fridge or the freezer during the day, and I completely forgot. But this is what my magic bag looks like. So I will show you guys. So this is what it looks like. I can put it in the freezer all day. It helps. Or sometimes if I'm in pain and the pain medication doesn't work, I'll put it in the microwave for about 3 minutes and 50 seconds, and it helps. Also, I find if the pain medication doesn't work, because it's not always going to work, then I will drink a hot chocolate like I am. The symptoms I've had during this month is obviously gallbladder attacks if I choose to eat heavy or greasy food. So that's going to happen. I've also been getting sick constantly, puking up a little bit of blood. I told the doctor about that, and they said that's okay. But if it's a lot, like a mouthful where it's constantly coming out, then yes, that's a serious problem and they got to resolve it. But also having the diarrhea. My grandma bought me these diarrhea pills that I can take that'll stop my diarrhea, but I find if I take them, though yeah, the pill works, it's just I'm going to be gassy after. Don't mind my messy hair. I took a shower. Very relaxing, by the way. So I had to find them now. Oh, they're right here. So these are the diarrhea relief pills that I'm taking one tablet each time I notice I have diarrhea. About 10 minutes later, I don't feel the need to go to the bathroom, but I do feel really gassy, like I ate a whole bowl full of beans. So I have a question from a fan, Scott Batrim. Sorry if I say your name wrong. Will you be doing a live broadcast directly from the hospital? That would be epic. Unfortunately, no, because they don't allow me to video my experience, so I'll have to do an after video. So I would definitely do an after video. Like when I do finally come home, I will show you guys my incisions and explain to you what my experience was like. Like I explained in my last video when I announced that I was having a gallbladder issue and I had to go for surgery. Two things are going to happen when I wake up from my surgery. I'm either going to cry because I don't know where I am, or I'm going to shake constantly like I came out of a freezer and feel like, I call it freeze shock. You call it what you want. But so I've also noticed after getting sick so many times, I have a sore throat. So here's what I've been doing, a little life hack. Hot chocolate with peppermint candies, whether it's peppermint itself or it's those candy canes. But candy canes are hard to buy right now because it's not Christmas. As a matter of fact, yesterday was the first day of summer, so you can probably guess Christmas is quite a ways away. So, but that's basically all the symptoms I've been having. I also didn't put sunscreen on the one day, and I got complete sunburn on my upper body. So my grandma was very nice to buy me some sunscreen, which I showed you guys. I put in my suitcase there. So that works. I've also got this moisturizing soap from Avon I've been using on my skin. It's helping. The sunburn doesn't bother me, actually. So I didn't get that bad of a burn, just more like a tan that's red. So that works, but I'm going to start putting sunscreen on. But yeah, I don't plan on doing my nails. But I do have some entertaining videos coming next weekend. Not this weekend, next weekend. My brother's going to be down, and I got some exciting content for you guys. Let's just say it's exciting, entertaining, probably going to be hilarious. So you can look forward to that. But yeah, after my surgery, when I do come home, I do plan on doing an updated video and explaining to you guys what happened. So I went to my consultation. They explained to me what's going to happen. They're going to do, this is the belly button. Technically, I got corrected. It's called an umbilical cord, but I grew up calling it a belly button, so a belly button it's going to be called. But anyways, this is a belly button, and they're going to do an incision there. They're going to put the camera through. And then one of the sides, I'm not sure which one. I think it's the right side. I'm not sure. They're going to do 3 smaller incisions. So 4 incisions total. They're going to remove my gallbladder, and they might tell me how many stones I have. I might have more. I tried passing the stones with what they call a pink lady drink. Acid, Pepno, and Tums mixed in one drink. Disgusting. It made me feel like I wanted to barf, and it wasn't helping. So I tried passing the stones. It's not working. So I had 2 other options. I can deal with this problem the rest of my life and watch it get worse, or just go through with the surgery. Now, to be honest, I chose to go through with the surgery. So, yeah, next weekend, the end of June, I want my brother down. I don't care how much pain I'm in, how sick I am. I want my brother down before I go for my surgery. Now, I explained to my brother, he's 12 years old, that Sissy is really sick, and the doctor is going to give me medicine to make me feel better because I don't want to scare him. He does have disabilities, so I feel I'm doing the right thing by explaining that to him. So I don't know why I keep cutting half my face off. I'm so used to doing that with pictures. But yeah, links are down below to my social media sites. I will try my best to update you guys. And that I'm also getting a little annoyed with the hospital. They keep asking me, are you pregnant? Are you pregnant? Are you pregnant? No. And because no isn't good enough for them, let's do blood work. I've been asking the nurse, can you use the butterfly needle, which is the smallest needle possible? She says, yes, but it'll take longer. Longer doesn't bother me. I just don't like needles in general. So here we go talking about my surgery. So July 3rd, I got a call, not today, but next Friday for a time. Between 1 and 3, I got to call them and ask them for the Pacific time. If I don't call between 1 and 3, my appointment is canceled because that's the only date and time I can call. They're really Pacific about these things. But when I do get a time, then it'll be July 3rd. Now, I can't have anything to eat or drink 8 hours before surgery. The only medication I'm allowed to take that day, with a little bit of water. My grandma, again, was nice to buy me a new water bottle. It's pretty pink. Not dishwasher safe either. You just kind of pop off the lid here. You guys get the idea. So, but anyways, a little bit of water, and I can take my birth control because it's obviously controlling my monthly, my girl issue, as some people call it. But, and then they're going to put a numbing patch on whatever arm they're going to put the IV in. So let's say they're going to put it in my left arm. They're going to put a patch on my inner elbow right there. and it's going to numb up my arms, so when they put the IV in, I don't feel it because I have a habit of jumping. And as I explained, I don't want to make the situation more difficult than it has to be. So once the IV's in, then they'll tell me when they're going to put me to sleep. I'm not going to have a mask. They're going to put me to sleep through the IV. So they're going to use a needle, put it in the IV bag or the IV tube, and they're going to put me to sleep that way. Once I'm asleep, they're going to put me on basically life support, a breathing tube down my throat to make me breathe because I won't be breathing on my own. I will be paralyzed for the surgery, which is fine. I'm not scared at all. I'm actually pretty freaking excited for my surgery. Like, literally, now I'm all hyped about it because I'm sick and tired of being in pain. Like, I have friends asking me to hang out all the time, and I keep telling them, sorry, I have to cancel because I'm in so much pain. And even when I hang out with my family, I'm constantly getting sick. I'm even getting sick in my grandma's car. Like, she has a little garbage can, but I'm constantly getting sick. I'm bringing up some blood. It's disgusting for them to see. I feel bad that my grandma and my dad had to see that, but it happens. And I don't know when I'm going to be sick. It's just whenever. Like, I went for a walk this morning, got a Polar Pop, got Brisk, Dr. Pepper, and Pepsi mixed together into one drink, and I started walking and felt like I was going to be sick. But I never did actually get sick, so it's different each day. I won't know how I feel. But I just can't wait to get this over and done with. Like, I'm currently drinking some water. I'm basically every night before bed been filling this up with fresh water, giving the guinea pigs fresh water. So next weekend, when my brother comes down, I'm going to be doing some more preparing. I'm going to be cleaning out my guinea pig cages. I will show you guys my guinea pigs quickly. So here's my guinea pigs. We got Chico. Go. There's Chico. He got a little bit of a fur cut. I also picked up some sticks from outside, cleaned them for him, disinfected them. And he's been chewing on them, like disinfecting them by putting them, soaking them in warm water, and then drying them out in my dish rack so he can chew on them safely. So, he's pretty cute. You gonna purr? Oh, you're so cute. So a lot of people have been asking what's going to happen with my guinea pigs because, as most of you know, each night before bed I will make sure they have food and fresh water. My grandma has my spare apartment key, so she'll be coming by and feeding them and giving them some food if they need it. So, which is good. I really appreciate the help. And of course, we got to say hi to Pig, like a full piece. Do you want it? She's doing pretty good. I even wedged a stick here in her cage just so she can kind of chew on it. But, no, they're both doing pretty good, which is a good thing. Chico, do you want your dome? I kind of didn't put it back in her cage. I'm sorry. So I no longer put these blankets on top of their cage at night because we're going into summer. And yes, I have air conditioning. That fan over there is constantly running. There's one in my bedroom constantly running. There's air circulation, which is good. But I don't want to put the blankets on their cage anymore. They just sleep at night without them. They're pretty quiet. Chico here does once in a while like to squeal like he's crying for help or screaming. But I just tell him to go to bed. You want your dome? Want the house? So we just got some baby blankets here that a friend gave me. I'm going to give a couple to one of my friends because she's expecting. She's 3 months. We got Chico's cage. We got his dome. This is actually the bottom to one of the smaller cages, but I've been using it for his hairbrush, guinea pig clippers, and piglets brush because I don't feel like digging through that bin constantly to look for this stuff, so I put it there. Okay, do you want your dome? Chico, do you want the dome? So this is kind of like a vlog and an update with what's going to be going on. So, go into your dome. Go Go in the house. Go in your house. I don't know why you feel the need to chew on it, but pretty soon we're going to have to get you a new one. Because that's supposed to be a size medium, and you're going to become bigger than Piglet. Aren't you? Handsome? Chico, you handsome? Oh, we're so handsome. Look how handsome we are. You gonna play? He's just playing. Look how handsome we are. Now, a lot of people have been asking me, why are his eyes red? Is he blind? Was he born differently? No, he was just born that way. He's perfectly fine. He's healthy. He can see. I actually took Chico to the vet a while ago because I was a little worried for him because of his one toe. So I took him to the pet store and they did a full checkup for free. If I was to take him to the vet, they'd charge me $75 per guinea pig. So $75 for him, $75 for her. That adds up after a while. So he's perfectly happy and healthy, and so is she. They get their nails clipped once a week, grooming every day, twice a day, which is a good thing. But basically, the day before my surgery, I'm going to be washing all my baths. I have a basket over here in the corner. This is basically other towels and tea towels that are dirty. So I'm going to be doing a bunch of other preparing now. I'm not going to vlog that because I'm going to be posting other videos on YouTube. But yeah, if you guys have any comments, questions, or concerns, comment down below. Or message me personally on any of my social media sites. This fan is usually running every day, but I think I turned it off because we're in for a thunderstorm, and I don't know why, but here, I'll tell you guys quickly before I end this video. This is my computer, okay? I have to keep it unplugged, as you can see. It's not plugged in. You guys can see that. It's not plugged in at all. There's the plug. Anyways, whenever we have a thunderstorm, it likes to short circuit my computer. So, if this makes sense, if you guys are a technology freak like me and you know a lot about technology, you'll understand. Maybe you will, maybe you won't. But anyways, the monitor cord, there's 2 jacks for the monitor cord on the back of my computer. Well, the one got fried. There's 7 USB ports, 3 of them got fried. My speaker jack has to be plugged in the front because the back one got fried. So I've had enough of this short circuiting thing, or my computer getting electrocuted, or whatever the case is. So it's going to stay unplugged when it's not being used. The same with my internet box. I have a Hitron internet box. So that also, once in a while, when there's a power surge, it'll cut out my internet completely, and I have to completely reset the whole thing and possibly change the password. But so no, I'm still able to do cleaning. Like yesterday, I did cleaning. I vacuumed my living room, mopped my kitchen and bathroom floor, did my laundry today. Going to clean out their cages either tomorrow or later tonight, depending. But if you guys have any suggestions for a really cool, also addicting TV show or movie on Netflix, comment down below or message me, because I'm going to be binge watching, especially Unbreakable. I just started watching it again, and I think I'm on episode 5. So there's at least quite a few seasons I want to get through. So, but if you guys enjoyed today's video, please like, comment, and subscribe. And thank you so much for watching. I should probably do this up. But thank you guys so much for watching, and we'll see you all later. Bye.